is working at the practice today. Can I confirm your name, please?
Hi, doctor. I'm Bella Brown.
And can I know your child's name?
It's Jacob.
Okay, and his age?
Jacob is 4.
Okay. How can I help you today, Bella?
Doctor, Jacob has been having this bedwetting. He's always had it, but yeah, it's just a little concerning right now.
Can you more elaborate on that more?
What do you mean, doctor?
Can you tell me more about what he's been experiencing?
So he's been wetting the bed. Like he doesn't have. He doesn't really wake up to go pee.
Okay. And does this happen in the night or in the daytime as well?
In the night.
The night. And I'm assuming it's been happening since how long now? Like, was there a time where he was not wetting the bed?
Um, no, doctor. Actually, it's all been there.
Okay, okay, understand. And have there been any other symptoms? Any nightmares? Anything else that you would like to tell me?
No other symptoms or anything like that. He's very active and yeah, nothing, no problems.
Okay. And how is his the sleep schedule like? Is it regular?
Yeah, then he goes to bed by 7, wakes up by 6 a.m.
Okay, that is good. And as you said, it does not happen in the day, so that is a good sign. I would like to ask you a few more questions about him, and then we can discuss what we're going to do. Um, has he been diagnosed with any medical conditions by any chance?
No, nothing, doctor.
Okay. And how are you happy with his red book?
Um, it's okay. He's everything is fine. He
Okay.
runs around, plays, he goes to the nursery and all. But only worry is, John, his brother, his elder brother, he's never had this problem. He's like 5 years now. He stopped bedwetting at like 2.5 years or something like that.
Okay, okay. We can discuss that or once ask you a few more questions and we can get into all of that. And how was Jacob's birth like?
Sorry,
How was Jacob's birth like?
but I was
Yeah.
fine. Everything normal delivery, and after that we came home
Okay. No
immediately.
complications, I'm assuming. Okay. And are you happy with his development?
Yeah, his red book is fine. We go
Okay.
regularly.
Okay, that is good. That is great to hear. And is he vaccinated up to the current date?
Yeah.
Okay, that is great. By any chance, is he on any medications?
No, doctor, nothing.
Okay. Is he allergic to anything?
No, nothing.
Okay. And you said your other son, he attained nighttime dryness around the age of 2.5 years. Is that correct? Yeah. Okay. And do you have any ideas about this other than this?
No, doctor, nothing.
Okay. And you said you're just worried about this, that he's not able to attain nighttime dryness. Is that correct? Is there anything else are you worried about?
Yeah, that's actually becoming quite a big problem. I'm not even. He wants to go for there's a sleepover coming with his friends,
Yeah,
and he's embarrassed to go there.
I understand, of course. You must be quite frustrating for you to see him go through this, something like this. Can you tell me how the environment at home is like? Um, is he active and do you feel supported with picking him up?
Yeah, everything is. They're all very supportive. It's very active place around.
That is
Yeah.
good. Can you tell me who, other than your other child, who else lives in the household?
I live with my husband and both our kids, nothing else, no one else.
Okay. And can you tell me what you and your husband do for work?
No, we both work from home, both tech.
Okay. Okay, that is great. And by any chance, does anyone in the house smokes cigarettes? Okay. Drinks, alcohol?
Very rarely, but
Okay. We ask these questions to everyone, actually. So, from what I understand, he's been wetting his bed at night, and as he is still quite young, I will start off with that. I don't think it's a
2 minutes
concern
remaining.
um, situation. It happens to some people. Some people have attained nighttime dryness quite quickly when they are younger. Some people take a while. So we will keep a check on this. I will give you some tips regarding this. Yeah, you must have heard that, we should reward good behavior when when he attains nighttime dryness. The next day you can reward him with something, tell him that it's a good thing that happened. You should not punish whenever he wheezes at night, because that can, scare him, and that's not as good as positive reinforcement. We will follow you up in about a month's time. You can also come if you are concerned about something, if he experiences daytime wetness or anything that concerns you. You can come back to us and we can discuss further. Meanwhile, you can make these changes, maybe try to make him drink more water during the day rather than before sleeping, and make him pee before sleeping so that the chances of him wetting the bed at night are decreased. And then we can discuss more when we follow up. And if you have any other concerns, let's follow up in about 6 months' time, I'm thinking. And if there's anything else that I can help you with, let
uh,
me know.
any medication or something?
It's not needed now because it's quite normal to wet your bed around the age of 4.
Move on to the next station.
How do you think that went?
I think I needed to say a few more things, but then I thought the time was gonna be up.
I mean, it was really nice. I mean, I can see that you're thinking that, oh shit, I have to say this too. I have to say this too. I have to say this too.
Yeah.
It looks like you're just talking and talking and talking at some point.
Yeah.
Yeah, that's a very common problem that happens. Yeah, that is something that you'll only get with practice. You
Yeah.
have the patient talk more.
Yeah. There's so much to ask also.
There's
Yeah.
always going to ask, but
Yeah.
always try to see what the patient is actually there with. So when I said, what do you think my main concern was today? Why did I come here? When you asked me, is there anything else?
What do you mean? Like, what the main concern was? I think that the child was wetting the bed at night, and she was worried because her elder son stopped early on, so she thought it was something odd.
So to explain that part, I've also mentioned that that he needs to go to a sleepover, and I even
Yeah,
hinted
I should
it.
have discussed that as well, like for that.
Yeah, that's what I mean. You didn't have enough time to get all her concerns, but the data gathering is what hurt you basically. If you notice, you can go back in the video and see. So at 3 minute, I think at 2 minute 30 seconds left, you were still even at 2 minutes, I think you were still data gathering.
Yeah, yeah, I need to like get the time management thing right.
I'll just give it to the examiner. She'll give you better feedback.
Great attempt, I have to say. I mean, you managed to cover most points, but I understood that you knew this case, but you were
Yeah.
trying to that you knew in within
Sorry,
this
your
case.
voice cracked a bit. I couldn't hear.
Better?
Yeah, yeah,
So I could understand that you know this case, but then you were trying to fit in everything that you know of this case, which is
yeah,
something that a lot of people struggle with, especially as doctors, since we have so much information, we want to tell
yeah.
them. But the main thing about this exam is more than telling them what all you know, you need to mainly ask what do they know. Especially you
Makes
need to
sense.
they already understand and then build upon that. Then you will
Yeah,
realize you have to say is relatively less.
yeah. Makes sense
But
because time is the problem. If I got like more time, then I could have asked everything possible, but then they don't give you that long.
yeah. So let's just look at how you could have ideally conducted this consultation. So when you start off, you have 1.5 minutes for candidate information where you read the candidate information. So over here, you don't get much information. You get
Yeah,
this lady with a child who has some concerns. So usually when you don't have a presenting symptom or you don't have any information to go on what you're going in for, the only
yeah,
information that you have is it's a pediatric case. And you're needed to talk to the patient, address her concerns, and discuss the initial management. So you know it's a problem also. So when
yeah.
you know it's pediatric and they haven't given you, most of the times when they don't give you what the issue is, it's usually embarrassing, right?
Makes
So
sense.
an adult, you will think along the lines of STI or some embarrassing problem or maybe something more psychological. So that's when they don't usually tell you. Like even if you look at a patient perspective, they don't really want to talk to anybody who's writing this initial documentation for them down. They'll just tell you, I
Yeah,
just want, right? So then you'll get
yeah,
an idea what is the kind of patient that you're going to meet, right? So that's one hint. And apart from that, once you read it, so you have to make up your mind that it's going to be a sensitive conversation. So you'll have to approach it like that. And in this case, since you've understood that it was actually a primary enuresis case, it's not something that is a problem of the child. It's a challenging moment in a person's parenting, parenthood. So
yeah.
you have that fact. There is nothing wrong with your child, but I know this is challenging, and we have resources to help you understand this situation that you are in better. That
Makes
is
sense.
this consultation. All right. So let's understand a little bit about enuresis first. So enuresis is basically involuntary discharge of urine by day or night or both in a child who is usually less than 5 years of age, right? In the absence of congenital or acquired defects of the nervous system or urinary tract. All right. So
Yeah,
that is enuresis. So when you call it primary, if the child has never attained continence before,
yeah,
that's what you have to identify first. It's a 4-year-old child. That's one thing that you have, and you need to identify if it's primary or if it's secondary. That is
yeah,
one important question that you need to ask. And another thing about primary is you need to understand a couple of things about it. So less than 5 years of age, it's usually a normal scenario. So usually
yeah,
when you new information, so this was the case that we had. So primary enuresis less than 5 years of age. So the management is usually reassured, right?
yeah,
Now, more than 5 years of age, the management should be a little different because that's when people will start getting worried because others will also start noticing. So it will become more of a
yeah,
social issue, right? So they really want a resolution for this. So you have long-term control, tactics where mainly they use conditioning. So they usually have this enuresis alarm. So like throughout the day, they will condition you to go to the loo once this alarm rings.
particular time. Yeah,
And also, like you very clearly and very excellently mentioned, that it's always a positive reward system. We're trying to reward their positive actions because they are more encouraged. Because these kids, they don't know that it's wrong or it's not actually their fault, right? I mean, if
yeah,
it's not can't control, it's not really your fault. You can help them. That's
yeah,
the main thing that we are trying to bring forth in this consultation. Mainly that do not go negative on your child. Make sure you reward And in a way that you can actually induce this control is by using these alarm techniques. This is for
Yeah.
long term. Now, for short term control, which is again our case because he wants to go to a sleepover, right?
Oh,
So
yeah.
you term control is so usually for long term, I mean, for children at the age of more than 7, we try medications like desmopressin. Desmopressin is usually to, make less urine.
Yeah.
So we tried for children of 7 years of age, but you don't want them to be, socially or emotionally stunted because of this issue. So we can try it for children for less than 7 years of age as well, according to the need. That is
Yeah.
something cooperate. We could say that since you are actually going through this, I can talk to my seniors. We can talk about what we can give. But if you think about it, desmopressin is almost the same as Enuresis alarm. In a way, you're medically controlling this, and over here, you're controlling it with the conditioning.
Yeah.
Yeah, that's why it's a long term and a short term thing. All right. And
Yeah.
if still doing this, it still doesn't work, then you have to refer to a secondary care. So that is also something that you can say that we have ways to try these out without having to go to secondary care. If it still doesn't work, we can still refer you. You know,
Yeah. Yeah.
so that much information you have in your mind about the primary enuresis. Now, if you're talking about secondary enuresis, this is also something that you have to rule out. So first of all, you can rule it out easily because you will definitely be asking since when has this happened. So
Yeah.
the shield beginning. So he's never had a period of being dry at all.
Yeah.
So you can definitely rule that out. But other things that you definitely have to rule out is the conditions under which the secondary enuresis occurs. So that is usually due to some emotional triggers, like
Yeah.
if abused or if the parents are separating, they have to get
Yeah.
used to environment. Those are all emotional triggers for them. So this
Yeah.
was this the times they will start betting, or if they have any underlying conditions. So all your past medical conditions should have been focused on these underlying conditions that can cause secondary enuresis.
Yeah. Makes
As
sense.
soon as it's secondary enuresis, you have to refer to pediatrician. All right. Now
Yeah.
let's talk about it. So this is a very interesting tool that we have made to help you guys study. So we put all our cases into this and we divided it into 3 sections of candidate information, findings, where if you had said abdominal findings, urine dipstick, because that's what you're trying to rule out, right?
Yeah.
Then the examiner or the simulator would have given you the findings, right?
Makes sense.
In time guide, which is something that we specially made because one of the main problems that students are having is to fit all this consultation into 8 minutes. So,
True.
method in which as soon as you start the timer and
Begin.
the time,
Enter the room.
you can actually see what to do in 30 seconds in the 30 seconds window that you are in. So it will
That
give
is
you a
good.
guide on how to go about it. So if you pause the timer, you can actually see how to go about your consultation in one go. All right, so that is interesting
That
data
is
from
useful because the cases that I did not perform well in, I think like in 2 of them I had the time management issue.
right.
Yeah.
so so this is something that we have seen that was our problem as well, and we realized that we have to do this for all the cases. So we thought that this would be really helpful for people who are practicing at this point. So
Yeah.
right, so this is your results from our sheet. So
Yeah.
you patient's name, identify the patient, and you're asking about the presenting complaint. So
Yeah.
immediately after the case, as soon as you understand the presenting complaint, that's when so there is going to be just 10 minutes for this call. So we'll rejoin on this link. Everybody who is
Okay.
out there,
Yeah.
please on the same link so that we can continue our discussion.
Yeah.
We'll move on. So you ask the name. So as soon as you understand the presenting complaint, that's when your time starts ticking. So you need to ask only the needed information you need to give them the right kind of treatment. So at this point, you don't even know the problem. You don't even know what treatment you need to get. So as soon as you ask about the problem, they'll say the bedwetting is the problem. You ask, yes, please elaborate more. And if they say, what do you mean elaborate? Like, what do I say? So then
Yeah.
specific Like, since when has he been having this? Has he been always having this? Is it at night? Is it just in the morning? And how often does he have it? And every day, at any particular time of the day, does he have that? So then from this, that if it's primary or secondary enuresis, right?
Yeah.
And then you start differentiating. So just start ruling out all the secondary enuresis causes, like UTI has fever, how is his DN2? In between that, but DN2 usually you ask within the P binds. So you can keep it for then, or you can ask it just immediately with the secondary causes. Has there been any emotional problems in that the child needed to be adjusted with? We definitely spoke about the terrors and all that. That is also
Yeah.
constitutes that could happen together with it. But yeah, you managed to get some points in. But mainly what you have to learn is UTI, diabetic DM, as well as constipation. So you can ask about the family history as well, if anybody has conditions like diabetes, right? Just to understand, and then ask about the PBI, how was your pregnancy? But think about the questions that you're asking. The pregnancy may not be important for this particular condition at all. So cut that out. What is important is the development and the V and poo questions and
Yeah.
the red book, right? Red book and the questions. So once you got that, then you move on to the next part about I would like to investigate the child. So you have understood from the mother that he does not have any secondary cause of enuresis, but
Yeah.
you so the only way you can be sure is by actually doing those investigations on the child.
Yeah.
BDs that you have to rule out, you have to investigate for them. You get marks for findings and examinations separately. So you need to
Yeah.
understand to do the findings and examination. If you're thinking about something that could be causing this issue, you have to do those examinations, right? So the
Okay.
examination, or most likely do is abdominal examination, normal general physical examination, a dipstick, and some routine blood tests to rule out infections, right? And then once this is done, then you have a holistic idea that this is a primary enuresis case without any for a normal child. All right. So now you have to ask, what do you think? Do you think that it could be because of anything? Do you have any idea why this could be happening? So
Yeah.
she's like, he's always been bedwetting. So do you have any particular concerns? Then that main concern of this child having to go for a birthday party might come up. So then you
Yeah.
know that the desmopressin. So that's how you know, like, all right, medications I may have to put in, right? Now your
Yeah.
management, you start. And then the other thing is you're trying to get the expectations of this patient on
Yeah.
what patient trying to expect medication. So they'll tell you that, if you could give me some permanent and some temporary measures as well, then you know what your management is. So now you know completely what to talk about in management, right?
Yeah.
When you are going to start talking about management, the first thing you need to do is you need to introduce the disease to them. You need to
Yeah.
introduce the name. You have to give the name. There is marks for diagnosis. You see? So when you actually say the words like so what Jacob might be suffering from is something that we call primary enuresis. Have you heard
Yeah.
about that? You put a complicated jargon in front of them. So make sure
Yeah.
you first understand them and then you explain that. Right?
Yeah.
And then when you move on to explain that to them, so then they'll tell you, no, I haven't heard it. What is it? So then you explain it that this is actually when a child does not attain, dryness, does not
Yeah.
attain all continence, like control over his bladder. This is the issue, and usually it's normal for children age of 5. That's what you have to tell them mainly. That it is a normal condition. This is a challenging time and your parenting, right? So then
Okay.
once they understand that fact, so because you're actually talking to an entity, you need to
Yeah.
understand that what will be their social concern because this is a holistic kind of treatment that you're trying to give, right?
Yeah.
You have to think about all their things that might be going through their mind. They think, is my child abnormal? The first thing you have to clear out for them is that your child is not abnormal. This is absolutely normal. But since you have already told us that your other child who has attained, dryness at the age of 2.5 years, that varies between children. You don't need to be worried. You need to establish that fact. It's not a competition.
Yeah.
Everybody, right? Once you're done with that, then think about the managements that you can say. Usually, if you look into the GMC website, these are the things that they tell people on how to train your child, right? So usually you
Yeah.
try giving them water during the day. Make sure they go to the toilet regularly, around 4 to 7 times. At least make them sit on the commode, and then let them try at least, including
Yeah.
the it. That's very important, right? Reward the
Yeah.
child positively, especially if he does important tasks like going to the toilet before bed, or using the toilet at a certain threshold, 4 or maybe 5 times a day. Use waterproof covers on your mattress and duvet, and make sure that the access to the toilet at night is very easy, right?
Yeah.
And important do nots. That is, do not punish your child because it's not their fault, right? They
Yeah.
haven't know how to get that control. So you're trying to only help them out, right?
Yeah.
And things to, aggravate this issue that the child is having. So if you're going to punish them, it's just going to get worse.
Yeah.
And the other thing make it worse is, if you actually give them drinks containing caffeine, right, that will also make them pee more. The treatment that you're trying to offer is to reduce the pee. So you really don't want to do the other thing, right?
Yeah.
This is also an important point where do not regularly wake or carry your child in the night to use the toilet. This will not help them in the long term, right?
Yeah.
You have to don't break the conditioning. All right. So now this, if you see the setting, you have come to the GP, and in the GP, what all can you actually give? This is the GP clinic. So what all can you do? So the GP, what they can do is they can actually tell them about the conditioning mechanism, or they can give medicines to reduce the pain, right? So those are the
Mm.
two that are given these first, right? So now in this case, you might actually want to give the medication, right? So you may have to consult with your senior for that. So first line, you give an enuresis alarm and reward system, and give them general measures to avoid fluid and toilet habits. Second line, you can actually offer desmopressin for short-term use if alarm fails or if they actually have the need, right? And
Yeah.
also Enuresis telling them further that these are the methods we can try. But if we fail, we can always, there are more methods. We can refer you to the Enuresis clinic where they will have more methods that they can try to help your child attain control over his bladder, right?
Yeah.
And other things that you need to do is if you identify any social issues, address it. Make sure you tell them the importance of positive reinforcement rather than the negative reinforcements,
Yeah.
right? Push your child. Those are important psychological measures that you have to tell them, right? And senior colleague, if you're actually trying to maybe prescribe desmopressin, or you would want an input, right? Leaflets, you missed out leaflets, so you can always, these are the three things that we tell people that once you hit 2 minutes, start wrapping up your consultation,
Yeah.
wrapping up. So you have to start telling them that how about you might not retain everything that we spoke about today. How about I hand you some leaflets and pamphlets so that you will have a better understanding of what you're going through, and you can address it better. Schedule a follow-up appointment. Definitely, you need to see how the child is doing to give further advice, right? And right. So leaflet, pamphlets, and safety netting. Usually, the safety netting over here is that, if the child is not keeping dry, he might end up talking about the safety netting that we can incorporate in this. So safety netting is again, what will happen if the child does not, remain dry? He might get an infection. He might, start getting used to that dirty place, right? So you need
Yeah.
to tell changing the sheets regularly, right? Think about the safety netting that you can put in. And also, if DM is also a risk factor for actually causing enuresis, think about, family history, think about looking out for signs of DM, because that could be one of the causes if at all not identified, right?
Yeah.
So that was the overall feedback. And let's just look at interpersonal skills. So once you understand that this is a challenging point in their parenthood, you have to actually address that. So this is what you've understood. This is a challenging parenting for them. So I'm so sorry. This might be very hard for you. I'll try to do whatever I can to help. Say a few words like that. So your interpersonal skills can be identified, right? Like provide clear explanation and reassurance about the bedwetting, like continuously reassure that this is not a competition. People have their own rates of learning and getting control over things, right?
Yeah.
And encourage them to ask questions. So it came to a point, like Dr. Rohit mentioned, it came to a point where you were trying to fit in every point that you knew. But maybe that is not something that the patient wants to know at all.
Yeah.
How to identify what they want to know?
Yeah, I wanted the medication basically.
There was no chance to ask questions
So,
for the
Dr.
patient.
The main thing that he wanted was medications, because the main concern of the mother over here was that she wanted to make or allow her son to go for the sleepover. Like,
Yeah.
how do patient? That's mainly her concern.
Yeah, and you set up a follow-up for 6 months. Never do that. That's way too long. That's something that they can get an appointment now itself. So even if you know that it's a long-term condition, always make sure you say few weeks. We'll see you again in a few weeks to see how the treatment is working, because they might have a lot more doubts that they would want to ask.
Right.
Makes
Yeah, in
sense.
doing that as well, right? Like in 6 months, a lot can happen.
Yeah, at this point, I'm gone. I have no idea what to do. You only told me learn from the website itself. And I can only talk to you again in 6 months, right? Always
Yeah.
consider what is going after they talk to you and leave. What is going to happen to that patient? Always put yourself in their shoes.
Right.
Makes sense.
That's also something we're trying to incorporate on after whatever you've told them. What is the situation of the patient that you've just discharged
Yeah.
on a later date? But yeah, as of now, we have this tool to help you fit your entire consultation in 8 minutes. And the other important thing about interpersonal skills was the decision-making process. So this would have been important if you had already asked her what you have tried so far. You understood
Yeah,
that
that's true.
it's been happening for the past, 4 years now. Like, so what have you done so far? Right. So from there on, build your management. So if she says that no, I haven't done anything, then you can start from base. You can start from the beginning, give her less fluids, toilet habits, and all that. But then if she says that no, I try doing that, then you can start about the alarm. We can start about let's try for 1 more year. Let's see once he's 5 years. If not for the long term, we can also try medications where we can teach him to control, right?
Yeah.
And provide material to reinforce the consultation. It is something you miss. It's something that you can do for every station, and that also counts for interpersonal
Makes
skills.
sense.
Right. So thank you so much, Dr. Minakshi. We had a
Thank you
really
so
fun
much.
session.
It
Please
was
sign up.
really thorough.
We can actually give you access to the cases that we have so far in the workbench. Then you can start practicing. You can tell us your real-time feedback on how your practice sessions are going. If you want something, you can make our product better.
Yeah, we made it very seamless. All you need to do is send a link to anyone who can read and speak English.
Yeah.
Then they'll be later and examiner. Yeah.
Absolutely. There is also a patient information as well, where they can actually, anybody who actually knows how to speak English can actually be a simulator and can mark
That's
you.
good. I'll definitely try that.
So we're trying to bring about a standardized way to practice. Because nobody actually has any standard way as of now.
Yeah, for
So,
PLAB
Yeah.
coding, will pass.
yeah.
Yeah,
Literally,
it's so
there's
hard to find people to practice. Like no normally with most of the people who are preparing, they want to be really scripted. Like they're like, don't say hi, say hello. Like, I mean, no one's gonna cut my marks if I accidentally go there and say hi.
That's not the content. You need to understand what content you're actually saying and not fixate upon these small issues.
Yeah, exactly. So wait,
Yeah.
that is just points. So you fill
Yeah.
in the gaps what you want to
Want to
give.
say how you would say it.
Mm,
Even different methods of how you can ideally say it also with the in-time guide, but
Yeah.
make things that you need to cover so that you have an idea of you have a thinking process of the consultation that you're doing. That's
Yeah.
the main thing about.
yeah.
Sorry, voice was cracking. I couldn't hear the last thing you said.
I was just saying that we are trying to bring about a thinking process that you need to have in the consultation when
Yeah.
you're doing.
No, that is good. Like, people try to memorize everything, like, but